This scenario involves a nurse practitioner and psychologist collaborating to treat an older Vietnam veteran experiencing suicidal thoughts. The scene starts as nurse practitioner Ashley is wrapping up the patient's physical examination.
All right, Mr. James, from your physical examination and your cognitive testing, it seems you're stable in spite of your fall.
That's good, I guess.
However, you are showing some signs of dehydration, and I'd like to start an IV and give you some IV fluids. But first, I'd like to check your blood sugar because your diabetes could be associated with the dehydration. Is that all right with you?
That's all right, I suppose.
In addition to checking your blood sugar, I'd like to draw a complete blood count along with thyroid stimulating hormone.
What will that tell you?
Your record indicates you have a history of anemia along with hypothyroidism. The fatigue that you're experiencing could be associated with one or both of those conditions.
I take pills for all that.
Your labs may show us that we may need to change your medications.
Oh, I don't know if anything can change the way I feel.
You know, Mr. James, your physical health is only a part of the equation. Can we talk a little bit more about what you were telling me before about life as being so hard lately?
I just can't do it anymore. She was my world. Now there's nothing. I feel like I've lost control of everything.
I'm really concerned that your biggest problem right now is how sad you are. Do you think you'd be willing to talk to our clinical psychologist?
I'll see your psychologist, but it won't help. I've got no reason to go on.
Mr. James, have you ever thought about hurting yourself or taking your own life?
The thought crosses my mind. I don't know. It's just so hard.
Thank you for sharing that with me. I'm going to draw your blood now, along with starting the IV and giving you some fluids. And then I'm going to grab Dr. Crumlish, and she'll want to speak to you further.
Okay.
All right, I'm going to tie the tourniquet now. All right, and you're going to feel a little pinch, okay? 1, 2, 3. Tourniquet off. Okay, Mr. James, once the IV's finished, the nurse will come in to remove the IV. Then you can go ahead and get dressed.
Okay.
Hi, Dr. Crumlish. Do you have a second for a psych consult?
I do.
Great.
What's going on?
So I saw this 74-year-old male. He came in for a fall, and then he mentioned to me that he just didn't want to go on. So I asked him about suicide, and he said he had thought about it.
Wow, sounds like something I could help with. It's good you thought to get a consult. Do we know if he's already seeing a therapist?
I didn't ask him.
It's all right. Sounds like he's in distress and should speak with someone now. Is there anything else I should know about his physical condition?
He doesn't seem to be injured from the fall. He passed all his cognitive testing. He did have some dehydration associated with his diabetes, so I did give him some IV fluids. And
is there something else?
I'm not sure if it's worth mentioning to you.
Please go ahead. I think it could be important.
He does have a history of hypothyroidism and anemia, both of which do show the same symptoms of depression.
Some psychiatrists are checking the blood count of women exhibiting symptoms of depression to check to see if anemia is an underlying cause due to the high rate of the condition among women.
That's what I was thinking. So I drew a TSH level and CBC, but I was also thinking maybe you could go and speak with him.
I agree. It sounds like he's in distress and should speak with someone now.
It sounds like we're going at this at both ends. Do you think that you could see him today?
Yeah, I do. I think it'd probably be good, though, if we went together. Given that you already have rapport with him, I think an introduction from you might make him feel more at ease.
Great, let's go.
Great.
Hi, Mr. James. This is our clinical psychologist, Dr. Crumlish. If you're still willing, we'd like to talk to you about how you've been feeling lately.
Okay.
Hello, Mr. James. It's good to meet you.
It's nice to meet you as well.
Nurse practitioner Ashley thought we should have a conversation. Now, just like with you and Ashley, everything we talk about today is confidential. It will remain between you, myself, and Ashley. There are some exceptions, however. If what we talk about today raises some concerns about your safety or the safety of other people, we may need to break confidentiality to make sure that you and other people are safe. Do you understand?
Yes, I understand.
Great. So, nurse practitioner Ashley told me there have been some difficulties since your wife moved to an elder care facility.
Yes, that's right.
Could you tell me a little bit more about this in your own words? What's been going on for you?
My wife, my sweetheart, and I have been married for 50 years. And now they tell me I can't take care of her.
So you've been taking care of her for 50 years?
50 years, the love of my life.
So who is it that thinks you can't take care of her anymore?
My kids. They think that I can barely take care of myself.
So your kids can't see how important it is for you to take care of your wife and to be independent?
No, they put her in that place, and she wakes up every morning. I'm not there. I take the bus there every day to be with her. We just sit in that room, but it's not our home.
I'm so sorry. This must be so difficult.
Yeah, and there's nothing I can do about it. Yeah.
I'm so sorry.
It's okay.
Could you tell me a little bit more about some of your thoughts and feelings about this?
It feels like I lost her, like I let her down, you know? But there's no way to get her back, since my children think that I can barely take care of myself.
So you've been taking care of your wife for 50 years, and now you're being told you're no longer able to take care of her?
Yeah, I just don't know what I'm going to do. It doesn't seem like anything's going to change. I have no say. I lean on my kids, but they have their own lives. It's just better if I don't be around anymore.
Do you feel like it'd be better if you weren't around anymore?
Yes, just take myself out.
So it sounds like some thoughts of suicide have been coming up for you.
Yes.
So it's more common than you might think for people to start having some of these thoughts, especially with the grief and loneliness that you've been going through. And it makes sense that this is starting to seem like a logical option for you. I'd like to ask you some more questions about some of these thoughts and feelings you've been having.
Sure.
Have you made a plan for how you might do it?
Well, I have my old revolver.
So you do have a gun in the house.
I used to have a lot of guns in a cabinet, but I gave those to my sons. But I kept my old revolver.
And where do you keep it?
In a shoebox on the top shelf of the closet.
Have you taken it out since you started having some of these thoughts of suicide?
Yes, one day I did. And I put it on the kitchen table. I sat there looking at it and thinking how easy it would be.
Have you done anything more than just look at it?
Well, I took it in my hand and I held it. It wasn't loaded. I just wanted to see what it would feel like to be back in control again.
Anything else? Did you aim it?
I just held it. I got to thinking about my sweetheart being left all alone, and I just couldn't do it.
So your wife is still a reason for you to keep going.
Yes, ma'am.
Have you ever had thoughts like this before at any point in your life?
Yes, my son passed away as a young man, and I just almost couldn't get through it. You know.
I bet that was hard. How did you get through it?
It was my family. You know, I had to think about them, my wife and my children.
So I can see that being there for your family is something you really value.
Yes.
So what about right now? What do you have right now to keep you going?
My kids and my grandkids, the young ones, being able to see them.
How many grandkids do you have?
Oh my goodness, 22.
Wow, it sounds like you and your wife built quite the family.
Yeah, we sure did.
Yeah. So it's clear you really miss your wife and you're feeling hopeless about any changes for the better.
Yes.
And so understandably, some thoughts of suicide have started to come up for you, and you even gone through the motions of taking action on some of those thoughts.
Yes, that's right.
But still, you're here. It sounds like your wife, your kids, your grandkids, they're all your reasons to keep going.
Right.
Yeah. So I think perhaps working together with nurse practitioner Ashley and myself, and maybe getting some of your kids involved, we can help improve your situation and possibly find some reasons for you to reconnect to your feelings of being needed. And eventually, over time, hopefully those thoughts of suicide will become less overwhelming and eventually go away.
I just want to take care of my sweetheart.
And you know, I can't promise that for you, but with your permission, perhaps nurse practitioner Ashley and I can reach out to your family, maybe get a social worker involved, and talk to your family about some of the things that are going on with you.
That would be great because they won't listen to me.
In the meantime, today, I'd like to do something to help you with some of the feelings you're having when you're not feeling good about yourself or feeling safe. And so I'd like to see if we can set up some ways for you to help yourself when these thoughts of suicide come up. And so we can set in place some things for you to do to help yourself so you don't feel so desperate. And the tool that I use is called a safety planning instrument. So I'd like to be able to go through that with you today, and we can work on some plans that will be helpful to you so you don't feel so bad. Would that be something you'd be willing to do?
Yes, if you think it will help.
Good. A safety plan is a written document you create with the patient, which contains coping strategies and sources of support that patients can rely on to recognize, reduce, and relieve suicidal thoughts or feelings. The 6 steps of a safety plan are: 1. Recognizing warning signs of impending suicidal crisis. 2. Employing internal coping strategies. 3. Utilizing social contacts and social settings as a means of distraction from suicidal thoughts. 4. Utilizing family members or friends to help resolve the crisis. 5. Contacting mental health professionals or agencies. And 6. Restricting access to lethal means. Following these steps, you can create your own document with the patient or utilize one of the many safety plan worksheets available online. Since our scenario is imagined to take place in a VA facility, we'll review the steps of the Patient Safety Plan worksheet from the VA DoD Clinical Practice Guidelines for the Assessment and Management of Patients at Risk for Suicide. First, the worksheet describes its purpose. Providers and patients are to complete the safety plan together, and patients then keep it with them as a resource. The opening section of the worksheet actually covers steps 3, 4, and 5 of the safety plan: identifying friends, family, and in this case, because it's the VA and military, command staff on whom the patient can rely for social support; asking for personal and professional emergency contacts to use in a crisis; and providing the number to the Military Veterans Crisis Line. The next section doesn't directly address any of the steps. Rather, it encourages the patient to seek emergency medical attention in the event they still feel out of control. It then asks the patient to reflect on a series of questions to improve the chance the safety plan will be utilized. Then the worksheet moves to step 6, restricting access to lethal means. The worksheet notes common threats, including firearms, medications, household poisons, and sharp or dangerous objects. This section addresses part of step 1 by asking the patient to identify external stress triggers such as people, places, and situations that might require the patient to pay extra attention to their physical and mental state. The next section builds on the previous one and completes step 1 by asking the patient to identify warning signs of a crisis, including thoughts, feelings, behaviors, and symptoms. The final section addresses step 2 by listing things that might calm or reset the patient, as well as healthy activities that might serve as a distraction.